Okay, this is part 2 of Prevent and Reverse Stroke and Heart Attack by me, Pete Rogers, available at Amazon. Here is where we're at, figure 1.3. We're on page 9. And this is the great paper of William Roberts. I know I spoke briefly about it in part 1, but I just want to make a couple key points from this paper. The biggest thing he found out was that coronary artery atherosclerosis, it's always diffuse. No exceptions, it's always diffuse. What that means is the old idea of, oh, this patient only has single vessel coronary artery disease. We're just going to bypass one artery, like the left anterior descending coronary artery. He said that's not really that accurate, that it was always present in all three vessels. You know, well, actually all of them, the left main, which bifurcates in the left circumflex, and the left anterior descending, and the right coronary. It was always about the same similarity in all three of them. It was just that the cardiac cath, they couldn't get a good enough picture of it to realize that. And the cardiac cath always underestimated the amount of stenosis, amount of narrowing in the coronaries compared to the autopsy. And what's the point of that? That has tremendous significance, that statement. What it means is you can't win the game. It's impossible to win the game with a surgical bypass or a stent because the atherosclerosis is everywhere. It's a systemic disease, okay? So once you get that, then you've only got two options left. Either you fix your diet or you take pills. And you could do either one, but the pills don't work so well. They help a little bit, but not much. Whereas the diet has a tremendous benefit. The Esselstyn diet, low-fat vegan diet. So that's the important thing to realize is there's no way out. There's no other way to win the game. That's it. You know, if there was something easier or better, I would do it, but there isn't. This is it. Okay, here is like an example of the kind of stuff that he was talking about with regard to stenoses. Here's a 100% open artery, so blood flow will be going through the artery like this. If you take a spot where you've got about 50% stenosis like this, you'll then see something like right here where you've got 75% stenosis, 75% narrowing, only 25% of the residual lumen. But here's the problem. On cardiac cath, you're going to compare it to the adjacent normal appearing segment. So what looks like it's 50% on cardiac cath is really about 75%. Do you understand the concept here? Because the cardiac cath estimation of stenosis is based on comparison with the adjacent normal appearing artery. But the adjacent so-called normal appearing artery itself is typically stenotic. So the cardiac cath will underestimate the stenosis. Okay? So what will look like 50% stenosis at cardiac cath is 75% at autopsy. What looks like 75% stenosis at cath is 95% at autopsy. What looks like 88% is 98%. So the bottom line is the patient's always much worse than the cardiac cath would imply. And there's no such thing as single vessel disease. These are really important points I'm making to you. That it's a diffuse disease. You can't win with a bypass or with a stent. It's just going to always be much worse than what you're going to see on the angiogram. And then he also makes the point, cardiac cath and cardiac CT angiogram, they can't even tell which plaque is likely to so-called rupture and progress to thrombosis, luminal occlusion. So they don't really know which one to treat. They know which one's the most stenotic. And what William Roberts did is he did these quantitative assessment studies where he would mark off every 5 millimeters on the coronary arteries. And then he would take these and he would chop them into sections and determine the amount of stenosis, the atherosclerotic burden in each one. And, you know, there would totally end up being about, the number of 5 millimeter segments altogether would be about 54. And like I said, he found out that it was always diffuse. It was never just a proximal stenosis and everything else is fine. It was always diffuse throughout these arteries. Again, you can't win this game with a bypass or a stent. That's an important thing to realize. That's a fundamental realization to have. That's what you're supposed to get out of this talk here today. He also mentions that atherosclerotic plaque is consistent with a blood clot and organizing hematoma. And once it forms, the immune cells go in there to clean it up. I already told you about this. They recanalize like a pulmonary embolism does, which we know to be a blood clot. And then what also happens is once the clot forms, it'll form on the far wall away from the median divider at a bifurcation point. Then circulating endothelial precursor cells will come and cover it up, and they'll turn into endothelial cells, like an intima. So that's a neo-new intima, neo-intima. Okay, and that's how it gets covered up. That's how it becomes subintimal. And that's why you can form an atherosclerotic plaque in a dialysis graft, because these circulating endothelial precursor cells will form a neo-intima on top of it that looks subendothelial. Okay, Dr. Roberts, and according to his research, by far the number one risk factor for atherosclerosis is elevated blood cholesterol level because it's prothrombotic. Okay, he says that's the most important atherosclerosis risk factor by far. Okay, and elevated blood cholesterol is well known to be a major atherosclerotic risk factor. I can also tell you in the cerebrovascular literature, hypertension is the most common cause of these small strokes. I've gone over that before in previous lectures with regard to the Jack Delatorre theory and the issue of cerebral hypoperfusion, apoptosis, and all that stuff. Okay, we'll get back to some more of that later in this book. Let's see. So he says elevated blood cholesterol is the villain, by far more so than everything else. And he's a big fan of statins, but I think he got some commercial money for promoting statins, so I'm less impressed by his opinion on that. He's an old school guy. He was a brilliant guy. He was the greatest cardiac pathologist who ever lived. He knows a little bit about nutrition, and he knows plant-based is the way to go, low-fat plant-based is the way to go. But I think he overestimated the benefit of statins. You know, they're mitochondrial inhibitors. They increase your risk of diabetes. You're robbing Peter to pay Paul. And they can have other side effects like fatigue, weakness, rhabdomyolysis, dementia. Not good. Okay, let's see what else. And the patient who gets their total cholesterol below 150 with statin doesn't have as good a results as somebody who gets there by diet. Okay. Other risk factors, yeah, we all know them. You know, smoking, hypertension, diabetes, elevated CRP, C-reactive protein, being sedentary, stressed out, sleep deprived. And there's some genetic component of you know, like a significant hyperlipidemia occurs in about 1 out of 500 people. It's pretty rare. Okay, he felt that the Ansel Keys 7-country study was the best study to show that lowering blood cholesterol prevents heart attacks. Okay. That the high-fat diet-eating people in Finland had tons of coronary artery disease. Yeah, and Pekka Puska showed when they turned around the coronary artery disease. He had some other interesting comments. This is William Roberts we're talking about. And by the way, you can go to his YouTube channel and just type in his name, William Roberts, coronary artery atherosclerosis. You'll find his channel real fast. Okay, Roberts has said if one gives herbivores like rabbits and monkeys a diet high in cholesterol or saturated fat, then they will get atherosclerosis. They're like in humans. Basically, if you feed a herbivore a high-fat diet, and humans are herbivore by physiology, like a herbivore, it generates atherosclerosis. That's how you produce atherosclerosis in plant-eating lab animals. Okay, Dr. Roberts also said people should eat a plant-based diet, maintain their BMI less than 25, avoid smoking, drinking alcohol. So that's what he had to say. Okay, we'll stop there today with the great work of William C. Roberts. I strongly encourage you to watch his videos. You'll see this guy's real smart, knows a lot, and did tremendous work. So anyways, I hope you found that helpful.